and welcome. My name is Kathleen Lvad, and I am going to do a presentation for my LUT1 class for Western Governors University. My presentation is, I'm going to talk about the Lvad pump. Research suggests that having an Lvad pump placed on your heart when you have chronic heart failure gives you a better quality of life, and it will also extend your lifespan while you're waiting for a transplant. I want to talk about the pump a little bit so you guys kind of get a picture of how this does help the heart. The pump is, first you have to have open heart surgery, and the pump is connected to the left or right ventricle, whichever part of your heart is failing, and it goes up and it's connected to the aorta. What the pump does is it pumps the blood out of the ventricle up through the aorta and out into your body, which gives your body more oxygen and your organs more oxygen. So in turn, this makes you feel better. You feel more active, and you can actually get up out of bed. People with chronic heart failure can't do a whole lot. They're just lay around. It's hard for them to walk upstairs. They get short of breath. This is a picture of a heart that's failing. It's enlarged. And this is a picture of a normal heart. A study was done at Hartfield Hospital from 2008 to 2011 for patients that had dilated cardiomyopathy. They studied two devices, the HeartMate 2 and the HeartWare. And what this study proves is that the heart, after 1 month interval, 3 months, 6 months intervals from surgery, the numbers shrink. So this means this part of your heart is shrinking, making it more healthier, because the blood isn't sitting here. It's actually getting pushed out and up into your body. So this is, each time they've taken the measurements and done the test, this part has shrunk. So this is why the pump gives you better quality of life. You feel better because your body's getting the oxygen and the blood flow that it needs. And another study was done. The other study was done at Northwestern Hospital, and they studied people that have already had the heart from 1 to 3 years, and you can see that the lifespan is 90 after 2 years. It stays really high, 90 to 80, 90 to 100%, and then it starts falling a little bit after 3 years. But most people that have chronic heart failure, they die of sudden cardiac arrest sometimes if they are not, the pump isn't put on their heart to help them. Some people can live on medications, but not near as long as you can with a pump. In conclusion, I'd like to say that the heart pump is a great invention. I dealt with this personally. My son, who is 27, his left ventricle collapsed and failed, and he has a pump on his heart, and he is up and doing a lot better. He actually feels like getting up and walking and doing things, and each month he's feeling better and getting stronger. And so anybody that has bad heart failure, I would recommend this. And I have some questions from the audience that somebody would like to ask about the pump. So go ahead.
How long do the batteries keep a charge?
All right, so the batteries that go to the controller that attach to the pump inside that turns the motor that pumps, these batteries will hold a charge 12 to 14 hours. So you can put your batteries on, leave for the day, take care of business, do your errands, whatnot, and come back. Or you can pack your extra batteries with you. So you're good to go.
Can the pump be removed?
The pump, yes, can be surgically removed. It has been removed in a small percentage of patients. Their heart gets better. With the pump taking the load off the heart, in some patients it will heal and start working and functioning normally on its own. So it can be removed. Sometimes if there's a malfunction, they'll have to surgically remove the one that you have and put another one in. So at times, yes, it can be removed, and then if you had to have open heart surgery, of course, they would remove it. So yes.
Can you still do normal activities with the LVAD?
You can do all activities, work, ride your bike, walk, all that. The only thing is you can't take a bath because it's connected to up through the inside of you, and this piece comes out right here, and you can't get that wet. Submerge it. So you can't go swimming, and you can't take a bath. But all other activities are okay with the pump. And so in conclusion, I'd like to thank you all for watching my presentation. And I strongly, and there's proof, that the LVAD on your heart, when it's failing, will give you a better quality of life, and it'll also extend your lifetime while you're waiting for a heart transplant. Thank you for watching, and that's the end. Bye.